field. When I was a child, I think I was around 11 years old. Then in my area where I lived, there were a lot of deaths among children. And then when I asked my mom, why is that woman crying? She said, oh, it's so sad. Her daughter died. I said, what happened? She said, measles. I was consistently hearing about measles. Measles. I don't understand what is measles. And then I'll ask her, mom, have this happened to me? She said, no, you've not gotten it before. So while I was growing up, I was furious because the government was not doing anything. Nobody was, maybe the government was doing, but was not reaching. They were not getting down to the grassroots, and this was happening. So I felt so sad, and I wanted a means of helping people, a way of being like a public health doctor. This is what I wanted, like a community health doctor, like helping people, preventing death, and all that. So I think this is where my urge, my passion for medical field and health started. So
welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to Public Health Careers. In today's episode, you'll hear more about 1, infection control and how important it is, especially from a disease surveillance perspective. 2, how mandatory youth service, or the NYSE in Nigeria, led to find a passion in community work and then pursuing a master's of public health. And 3, the value of volunteering to gain skills while you're looking for a full-time position in public health. Thank you so much for tuning into this episode. Be sure to hit that subscribe button if you are not as yet, so you can stay up to date with this content and other great content that's going to come out. Be sure to leave a 5-star review, as that really helps the show get out to more people and shows that it's valuable and helpful to you and will be helpful to others. And share this with someone who will get value from it, as that really helps the show get out to more people and expands our reach and helps other people just know how they can be impactful in public health. And if you'd like to support even more, there is a link below to become either a one-time contributor or a monthly contributor. So check that out. And thank you all so much for tuning in. Be sure to subscribe once again. Enjoy.
Hi, this is Faith Amarchi Ngwu, a public health professional, and you're listening to Public Health Careers.
Today, we have a public health professional with strong experience in disease surveillance, project management, immunization, and the importance of vaccination, contact tracing, health policy, and research. She conferred a Bachelor of Microbiology and Biotechnology at Enugu State University of Science and Technology in Nigeria, then worked as a Communicable Disease Control at Primary Health Center, Abakaliki, Nigeria, before getting a Master's of Public Health at the University of Port Harcourt. She is a certified lead auditor, ISO 14001 Environmental Management Systems, and certified safety personnel with the Institution of Occupational Safety and Health Working Safely. She currently is a Health Protections Coordinator at Primary Healthcare. We have Faith Amarchi Ngwu, MPH. Welcome to the show.
Thank you so much, Amari, for having me on your show. Super excited to be doing this, actually.
Awesome. And I'll give you a little cheer.
Thank you. I was
Yeah, I'm super excited to have you on. You have a very unique experience, at least compared to a lot of the guests that I've had. So I'm excited to hear about your insights and your story in public health. So thank you for taking time.
All right. Thank you so much for having me. Okay.
Yeah. And getting into the interview. So tell us, how do you identify?
Like Amari have already said, I'm Faith. I'm a Nigerian-based and Nigerian-born and Qatar-based public health practitioner. I'm currently living here with my husband and a daughter. She's 6 months old, and she's taking a whole lot of things from me. But even at that, I am someone who is a go-getter. I try to balance my life and my family life and my work life. So over the years, I have been into the field of public health, starting from when I graduated from my bachelor's degrees in microbiology and biotechnology. I started working in a primary healthcare center in Abakaliki, where I worked as a communicable disease control, in which we had to take public health down to the roots, to the deep roots of the rural communities for women and men and elderly personnel and children who do not have access to health care. So we take down this health care to them. For example, we take down vaccination to this family, especially for pregnant women and for children. And so over the years, I've grown to, I believe I'm a work in progress, but over the years, I've grown to be here in Qatar. And I'll quite tell you that in Qatar, it is a very good environment for a starter, for a public health professional or a new upcoming public health personnel to start with. So, and I have been in a Communicable Disease Control section where we do vaccination programs, immunization programs, disease surveillance systems, which I would like to give a brief overview of what it looks like. So as an identifier, I would say I'm your public health professional in making, and over the years, in the future, you will hear about me. So this is what I really have to say. Thank you so much. And I'm doing well. I'm very, very okay. And I'm happy to be practicing public health. I'm happy to be in this field. It is a field I would advise anyone to go into, because it gives you lot of insight and a lot of things to do and a lot of privilege to help people out there. Thank you so much for the question.
Absolutely, absolutely, and congrats to you and your family and your baby. That's exciting.
Thank
and
you.
Also, yeah, you're most welcome. I'm glad. And just for reference for people, so you said you're Nigerian born, living in Qatar. How long have you been living in Qatar?
Actually, my story in Qatar, I came to Qatar in 2017 while I was doing my master's back home in Nigeria. So I had to come around here and prepare my Qatar ID, which allows me to travel to and fro from Qatar to Nigeria to any other country. But I went back in the same 2017 to complete my master's degree, which I finally completed in 2019. And then I can categorically say that I've been living in Qatar permanently since 2019, April 2019 till date.
Okay,
so
that's awesome.
6 years now. I'm just
yeah. And I'm
just like
yesterday.
I'm
looking for right. And I'm looking forward to hearing about like what that transition was like for you and like what that decision was like for you. But before we get into all of that, I wanted to give you space to talk more about the importance of policy development as an infection prevention professional.
All right, thank you. So here we have two terms. We have a policy and we have infection control. First of all, we have to understand what policy is all about, and then we'll talk about infection control, and then we'll talk about the importance of policy development towards infection prevention and control strategies or intervention. First of all, simply policy means a guidance, like a regulation, like a law that guides any organization, any country, any firm. Okay, so policy has to do with steps, systematic rules and regulations that one must abide by. So now when we talk about, and we have to remember also that in every policy there is consequences for non-adherence. Okay, so now we have to talk about infection control. This is what we do in order to stop or mitigate a potential infection from happening. For example, especially in the healthcare setting, this is where we avoid hospital-acquired infections, and this is where we avoid staff, also the healthcare providers, from getting infected. So now, in infection control, we have some core functions or scope of infection control, like we have the hand hygiene, we have the PPEs, ensuring appropriate application of the PPEs, and then for the hand hygiene, ensuring that the staffs are in compliance with the 5 moments of hand hygiene. And also have the waste management. We have to make sure the staff or the nurses using the injections are putting the trash where it's supposed to be, and the appropriate labeled bucket or the bin for that. And then we have linen management, their PPEs, their caps, whatever they're wearing. We need to see also that it is being properly washed and disinfected. And also then we'll talk about CSSD. This is the Central Sterilizing Department. We want to ensure that the medical equipment are well sterilized and disinfected. So when we have all this, you will believe me that human nature is prone to non-adherence. This is what I'm going to say. So if you have a guideline, okay, or if you have an intervention, now let me talk about intervention. We'll do a risk assessment. I will use an example, hand hygiene. And we realize that our nurses and our physicians are not practicing appropriate good hand hygiene. So what do we have to do? After risk assessment, we realize that about 80 or 70% of our staff are not practicing good hand hygiene. We'll go back to the drawing board and we'll develop an intervention. This intervention cannot work if there is no policy guiding it. So this is where policy development comes into. So for every specific condition or situations in a health facility or in the health sector, there should be a policy guiding it, so that it will give more power to the infection control practitioners. Because if there is no policy, it is just a mere word, it is just a mere document. Anyone can read it and fly. So when we talk about policy development and infection control, it has to do with guidance, rules and regulation that guide the practice of infection control in the healthcare sector. So this is how I can relate policy development and infection control. I believe I'm clear enough for you to understand what I'm trying to pick out.
Absolutely clear enough. Definitely makes sense, and I'm glad that you highlight that we as humans kind of stray to the side of not adhering to things that people are asking us to do, and like as you said, like having those policies are just so important, so that there's like kind of something bigger that people need to follow, and that really just helps them understand like why this is important and why I need to do this to ensure that there's safety around the health system.
Okay.
Yeah. And then getting into, well, before we get into more of your public health story and getting into public health, what does public health mean to you? Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show.
It sounds so simple. Then we hear about public health. We can just say public and their health. It's talking about the health of the whole community. So simple like that. But first of all, we have to understand what is health. Okay. In our understanding, health, a lot of people think that health is just the absence of diseases. But health has more to do with absence of diseases. How is the mental health? How is the emotional health? How is the physical health even? So in general, health has to do with your state of total complete wellness, both physically, absence of diseases, emotionally and mentally and otherwise. Okay, now when we talk about the public has to do with a large number of people. So this is the difference between clinical medicine and public health. In clinical medicine, a physician or a doctor is attending to one patient, two patients, while in public health, it is like a cohort. Okay, we are attending to a multiple, a cluster of people, a higher number of people. We are targeting many more people in order to get the public health coverage. Okay, so public health has to do with organized efforts of the community. When we talk about public health, it is not just for me, Faith, or for Omari, or for anyone responsible to do this. You can't actually function in public health if you don't inform the public. There should be public informed consent, and they should consent, and there should be organized effort. For example, I'm going to use vaccination, chickenpox vaccination, for example. I believe in the UK they have a different view about vaccination, especially when it comes to chickenpox. This is where they do a pox party, where they bring in their children to mix with children with chickenpox, and then with the aim of getting their children infected to acquire a natural immunity. But now in some countries, like here in Qatar, the vaccination is very important. So now I'm going to use a country like Nigeria or Uganda as an example. So we have a lot of vaccine hesitancy found among these people. A whole lot of them do not believe in vaccination. Okay. So as a public health professional, you cannot just arrange with your team, put up your logistic and travel to a far-known rural country and then when you get to the villages or the communities, you're going to announce, everyone, can you please come together? I need to vaccinate your children. I bet you they're going to throw stones at you. Everyone, they're going to throw stones at you. But when we talk about public health being an informed consent and an organized effort of the community, first of all, before you gather your logistics and your human resources, you have to go and meet. In every community, there is a figure, a head figure who everybody listens to. It can be their king, it can be their chief, it can be their governor, it can be their spokesman or their spokeswoman. So first of all, you have to go and inform. And most often time, you don't even understand the language these people are speaking. So this is why in public health, you have to involve the community. You have to inculcate the public into what you are doing. So when you speak to these people, the spokesperson, and then they will transfer your information down to the public, down to their community, they will trust this person more than you because you're a foreigner. So public health has to do with maintaining the healthcare and the well-being of the general population with their organized efforts and their informed consent. So this is how I see public health. And also public health is very wide. We have the non-communicable diseases and the communicable diseases. When we talk about the non-communicable diseases, we're talking about chronic illnesses like the diabetes, the cancer, and all that. And they, for themselves, they have a whole lot of programs running. For example, nutrition, exercising, and all that. And then we'll talk about communicable disease in its own form. Communicable diseases have to do with the prevention of diseases that can be infected or can be transmitted from one person to the other, from the environment to the other, or from animal. The diseases we call the zoonosis to another. So public health is a very wide field which should be treaded upon with caution. So this is my understanding of public health, looking out for the wellness of the people, of the public, through their informed consent and organized effort. Thank you so much.
Yeah, I love that. And I love the perspective of like organized efforts of community and just how important that is to public health, because as well as the point around you saying that a lot of times we as public health professionals want to go into a community but don't know enough about the community, or like to your point, we don't know who the chiefs are or the leaders are, the people who make decisions, or the people that other people will listen to. And I think that is seen a lot in the US here with the lack of vaccination uptakes in a lot of communities because they didn't trust the vaccine, and maybe for good reasons. So it is like, how do you communicate that information with those leaders so that they are able to share it in a way that their communities would understand and would want to take this? And I think to that point is like just building those relationships with the community is just so important to all of this work. And I could only imagine specifically in Nigeria and Uganda, if you go to rural regions, just how important those kinds of connections are. And like to your point, you can't just go in there and say, I'm going to do this. People might stone you.
That should be a side mission, honestly.
Awesome. Okay. So, now getting into your collegiate story. So, as you said, you were born in Nigeria, and you got your Bachelor's of Microbiology and Biotechnology at Enugu State University of Science and Technology. So, can you tell us a little bit about the thought process of going into your bachelor's degree and maybe some takeaways from it?
Actually, it was never my first choice. I will tell you, it was never my first choice. It's been my dream to be in medicine, a medical doctor, but because of certain reasons or the other that are kind of confidential to me, I couldn't further. Even when I got admission into the medical school, I could not, afford it, or I was not able to get into that because of certain reasons. And then I have to switch for courses, and then I have to get myself in microbiology and biotechnology. And at the start of the whole thing, I was not quite interested because from the first start, this is not what I wanted. Okay. So I felt I've been coerced, I've been forced into doing this. But during my second year, everything was good. I was loving what I was seeing. I was enjoying my classes, my coursemate. I had a very nice coursemate. She's very good. Her name is Amaka. She's a trainer. She should qualify for a lecturer. With her, actually, there was a lot of dedication. Even when I wasn't serious with my academics, she would call me back. We'll have a tutorial here. We'll have tutorial here, because I wasn't interested. Okay. Even though I'm trying to get acclimatized to it, but this is not where I've always wanted to be in the medical field. I felt this is a distraction for me. So after my education, I did very well. Then I started looking for a job, which we'll have to talk about later. And after everything, I will tell you, it wasn't my, I'm going to be frank with you, it wasn't my cup of tea. This is why I had to venture into a public health, actually. So I don't have much to tell you about this. I'm sorry.
No. That I think in you saying a little bit there, you said a lot. And just like that perspective, and it's cool for you to highlight that a lot of the similar things that people here in the US or in the Caribbean are dealing with are the same things that you in Nigeria are dealing with, like wanting to become a physician and then realizing like there are different barriers to becoming that and figuring out other paths for you to impact health. And I think in that, it shout out to the people that were, whoever you said was being able to support you, and even when you were taking it as serious as you should.
Shout out
Because
to you, Amaka. Shout out to you wherever you are. She really helped me graduate and everything. So I'm still so much grateful to her for all her effort and her contribution and assistance. So
give thanks. So earlier you stated, and I'm glad that like you mentioned that it was never your goal to do a degree in microbiology and biotechnology, but then even before that, earlier in the interview you stated that public health is a great field to be in and more people should be in it. So I'm glad that it came full circle and you learned about what you can do now, right?
Yes.
Right. Okay. So you graduated with your bachelor's, and then you went to work as a communicable disease control at Primary Health Center in Abakaliki, Nigeria. And I think you said earlier that you were working with the Yoruba people. Am I correct in that?
No, with the Igbo people.
Oh, Igbo. Sorry. Okay.
Oh, you know, what do you know about Yoruba? Oh, I will talk about this later after this.
Yes, we can definitely. Okay, the Igbo people. I actually had a friend in school in Trinidad who was Igbo. Interestingly, so, yeah. But anyway, okay. So you graduated, and then how did you get into this job as a communicable disease control? And let's start from there. How did you get into that job?
After I graduated, before my graduation, actually, I had to do my IT, we call it internal placement, internship or industrial training in one of the military hospitals where I worked as a laboratory technician. Okay. So during my work with them, I was able to do certain tests like phlebotomy. I was able to bleed patients. I was able to do RVS testing for HIV. I was able to do some chemistry tests, CD4 counts. I was able to do a lot of culture tests. Okay, so while I was working, I had a manager over there. He's in the military actually. So he has someone kind of connection somewhere in the health center. Okay. So I spoke to him about having to work after my graduation. So fast forward to my graduation. So after graduation, I did my youth service. In Nigeria, there's what we call the National Youth Service, NYSC Corp. I don't know if you know about that. So this is a 1-year program where we'll have to do like a voluntary service to the community. You can be a teacher, you can work in the Communicable Disease Center, you can work in the hospital, you can work in the law firm. It depends on where you want to go. So while I was doing my youth service, I had to apply for a position in the primary health care center. So at that moment, this was the position they had. So they were looking for young people, vibrant people that can go into the community and speak to them. And actually, I can speak Igbo. So the community is an Igbo settlement. So I was privileged to be among the people, that healthcare workers that were sending to this place. So while I was doing this, I was deriving joy because it is close to public health. I had the privilege of interacting with different people, with different mindsets, with different characteristics. And then going into the village, it's like a playing job. Like this is somewhere you go to, you laugh, you talk to people, you get their understanding. You see that people have totally different mindset about certain things. So I started enjoying this job. So after my 1-year youth service, I was retained where I did my 1-year youth service. So this is where I continued my duties till after I went to improve on my career to get a master's in public health. And I had to place a resignation letter because I had to focus on my schooling because it's a full-time on-site, not online. This is the full-time on-site program. So I will tell you that working as a communicable disease control officer in primary healthcare Abakaliki actually gave me a direction. Okay, it's actually because when I graduated from my study, had no direction, nothing. I don't know what I'm supposed to do. I believed if not highest, I'm going to go into laboratory techniques or whatever, medical lab sciences, and just to get a job to feed. Okay. And then also to maybe feed anyone that is dependent on me. But getting this opportunity to work in primary health care actually gave me like a vision. Like I saw something, I was like, this is what you ever wanted. I think this is God making these plans for you. Follow this path, follow this route. So because I wanted more, I wanted to grow, I wanted to improve on my career. So I had to go apply for a master's degree. So this is all about my my experiences with primary. So this is how I went about it. It wasn't intentional. It was something that just happened, and I was privileged to be retained. I believe it's because of my my passion. You know, it is one thing to love a career. It's another thing to have a passion for it. So I loved my career, and I saw I saw a way, and I had passion about it. This is where I am today.
Yeah, love it. And yes, I have interviewed a couple other Nigerians on the podcast, and they have spoken about their youth service and them going into like very rural regions of Nigeria. And doing...
You can't imagine. Even most times, I don't want to talk about it because it is a rigorous exercise. Like they don't care if this community are fighting it. They don't care if there is insurgents in this community. You have to serve for 1 year. And without this service, you're not a graduate. So you can't begin to imagine. So, so this is about the NYSC.
Yep. Awesome. But I think it's awesome that happens in that way, because as you said, like this was something that gave you direction because you came out of your bachelor's degree, not knowing what you're going to do. You're saying like at the least resort, I can become like a lab technician and get my bills paid and have something there. But it wasn't something that you were passionate about. But in doing this youth service, in getting out into community and being able to meet people and see that like this is work, as well as you said, interacting with not only community members, but I'm guessing other people in this kind of public health sector was very informative for you. So what kinds of things did you do as a communicable disease control officer?
First of all, we have a setting, because most of our things are not automated. When you come to the rural area, most of the documents, most of the patient files are not documented. I was in charge of documenting them manually on the paper. This was my job, to document them. I was able to attend to antenatal women, doing lots of findings like health needs assessments. For example, if I have a patient who have no place to stay or have no place to give birth, or even after giving birth have no financial assistance. So we analyze issues like this, or we have a pregnant lady who is malnourished, or have a pregnant lady who has some disease or the other. We have to arrange our interventions according to our situation analysis. For example, if we have all pregnant women are advised to take tetanus injections, the tetanus vaccine. Okay, we'll call it the Tdap. The Tdap is for adults, and then the DTaP is for children. So my job is basically disease surveillance, health needs assessment, assessing the needs of the community. What does the community want? What is the prevalent diseases affecting the community? Is there a possible outbreak? So we are like the field investigators. So we are always on the go. We are always with the community. So we are acting like an interface between the community, the health center, and the government. So we participated in immunization programs and outbreak investigations. I can remember we had an outbreak of cholera. I believe the children in the rural area, they were presenting with a lot of diarrhea, watery discharge, fever, and all that. So we had an outbreak investigation, and I was part of them. In fact, I actually coordinated one of the sections, because we are divided into subgroups as community extension workers. So I had to supervise the community extension workers. So we collected data. So we had to identify the source of this outbreak. I think it was coming from a local booker. What we call a booker is a restaurant. So it was coming from a local restaurant. And then it was actually not the fault of this. The problem wasn't coming from the vendor. The problem was from the retailers, the wholesalers that supplied the food item. The food item was contaminated because it's a vegetable item. So I was able to relate this. So We have to do outbreak investigation, a thorough outbreak investigation. We have to collect our data. We have to analyze our data, and we have to investigate, reinvestigate again. So when we do the investigations, you have to make a lot of calls. You have to be on the site, and then you have to report what you found out. So I did the investigation, collected the data, put them on the system, analyzed the data, presented it like data visualization. Okay. So you presented it during the meeting, and intervention was able to be carried out. And I can tell you successfully, the cholera, in a day we receive about 10 to 15 cases of cholera. But after like a month, intervention was put in place. The food vendors, they issued some like I don't know how to put it in an English word, but it's like an ultimatum, okay, for all food coming into the community to be monitored, to be supervised, and all that, and it is mandatory. So it was given to the roadside men, because these are the people that don't have anything to do. So because of this program, so they had something to do. So they were serious about it, and everyone was, because these are the people that everybody fear. Okay, so when you put so when you put such a thing, you cannot smuggle things like vegetables, nuts, grains. You cannot smuggle it in and pass and just like maneuver these people. So they had to. Public health is so sweet, really. It's very, very interesting. So basically, we actually did the immunization program. The nurses, we had been the one vaccinating. For us, we are monitoring their hygiene level, their PPE, the administration of the vaccine, and to ensure that they are following the accurate vaccine cold chain. Because we have to take a code box. We are not taking the whole fridge to the community. Remember, we have to take the cold box. So the cold box will ensure the thermometer is working, the temperatures are between the recommended temperatures, and administration of the vaccine, if they are administering the right vaccine, the right doses, and in the right sites injections. So this is basically what I practice over my few years with the primary health care in a center in Abakaliki. And I must tell you, I enjoyed every bit of it. I really enjoyed every bit, though I had my sad days and my bad moments, but I really enjoyed every bit of it.
Yeah, I feel like that is just part of the work, because like at the end of the day, it is work, but like to your point, there's so much to enjoy in it. And it sounds like you did a lot of great work, a lot of like on the ground work, and work that I think is just valuable for any public health professional to do. And I can imagine the settings and the types of resources that you had to work with really, really informed you as a public health professional. And so you got your Master's of Public Health at the University of Port Harcourt in 2017. So my first question, I guess the two questions that come together is,
Okay.
how long were you at Primary Health Center? And then when did you learn about public health and wanting to get a Master's of Public Health?
Okay. I've been wanting to have this question. So actually, I stayed with primary health care in Abakaliki for like 4 years. Okay, 3 to 4 years. And then when I was looking for something to do, I have an elder sister. She's a dentist. So before, I never knew anything about public health. As a young lady, as an upcoming career developer, I was actually thinking all about medicine. I was actually thinking about going into medicine. I have done this course for my parents. So I actually wanted to do something for me. I want to do me. So then my sister said it's going to take a while getting an admission and who's going to sponsor you and all that. So this is a story for another day. Then she called me. She said, would you like to venture into public health? I said, what is the benefit? Because I don't know what I'm supposed to be doing as a public health expert or professional. I've not heard about it before. She said, okay, she's going to come home and she's going to talk to me. So I was not serious about it. So when she came home, she said, you can become a consultant in public. Actually, I heard consultants. When I heard about consultants, I said, okay, fine. I don't even know. I don't know. I have to go a long way to become a consultant. She said you can actually become a consultant when you go, when you practice for a very long time in public health. You have the privilege of practicing near medicine, but the medical aspect of it, or the healthcare aspect of it, is not just with one individual, one patient. This is your dream come true. You're going to attend to a whole lot of people, and then when you go for your master's degree with your experience back in the primary health care center, you're going to blow. This is the statement she used. You're going to blow. When I talk about blowing, it means you're going to skyrocket. Like your career is going to go like wildfire. So I was reluctant about it. Okay. she told me this even before I resigned, because she was the one who encouraged me to go for my master's, because if I still remain at this local level, at this, because for everything there's a time. Okay, there's a time to stay and there's a time to move. So she said to me that if I still remain this way for in few years to come, I won't get to where I want to get to. So she actually spoke to me about getting a master's degree in public health to advance my career. I never knew I was going to come to Qatar or have an opportunity to work in the government sector, in the healthcare sector here in Qatar. So this is how I applied for. I made a research online also, and I typed list of jobs available for public health professionals. First off, I wanted to know that I have options. I wanted to be sure that I have different options as a public health professional. Okay. So I saw that I have a lot of options available for me. So I had to apply. The first day I applied, actually, I didn't get an admission because they've closed the application date, and what was available was environmental health. So I never wanted to go into environmental health, which is a very fantastic course on its own. It's a very fantastic course on its own. But because I have a passion for something, this is where I wanted to go into. So while this was going on, I got married. Okay. So when I got married, I thought everything was going to die out. Okay, but I was blessed. My husband supported me. He encouraged me to go for this. He footed my bills and he encouraged me with my assignment. He was assisting me with my project, with my assignment, and everything was actually going like it was planned by God. So during my master's in public health, I did some courses, like I focused in epidemiology of communicable diseases. So had different courses like epidemiology, biostatistics. We dealt on health policy and management. We did health leadership and management. We did monitoring and evaluation. We also had to do population health. We have to do a diverse course. There are so many courses. Like I said, public health is very wide. We have to do even primary health care centers. We have to do leadership in healthcare, equity in health, a whole lot of it. And we have to do, what I love about primary public health is that it is practical. You can relate to what they are saying. Like, for example, some courses, if you don't see them, you cannot understand them, right? But these, when they are talking about diseases, when they're talking about chickenpox, when they're talking about measles. Now, when we talk about measles, why I wanted to go into the medical field. When I was a child, I think I was around 11 years old. Then in my area where I lived, there were a lot of deaths among children. And then when I asked my mom, why is that woman crying? She said, oh, it's so sad. Her daughter died. I said, what happened? She said, measles. I was consistently hearing about measles. Measles. I don't understand what is measles. And then I'll ask her, mom, have this happened to me? She said, no, you've not gotten it before. So while I was growing up, I was furious because the government was not doing anything. Nobody was, maybe the government was doing, but was not reaching. They were not getting down to the grassroots, and this was happening. So I felt so sad, and I wanted a means of helping people, a way of being like a public health doctor. This is what I wanted, like a community health doctor, like helping people, preventing death and all that. So I think this is where my urge, my passion for medical field and health started. So during my master's degree in public health, I saw that I can relate to certain level to medical field, to medicine. So I did a whole lot of seminars, did a lot of field visits and site visits. And at the end of the day, I did my project, which was outstanding and has been published in Asian Journal of Medicine. And while I was doing my master's degree in public health, so I had to make an internship application to the Ministry of Public Health in Qatar. This was just by luck, and I was really, really lucky. I was accepted to do that. And this is where my career about public health kicked off. We'll talk about that in the next time or in this section. So this is how I got into public health.
That's awesome. Firstly, shout out to your sister. Secondly, shout out to your husband. Because I could only imagine like just how fundamental they were into everything that came out from there. Like from your sister coming down and sitting down with you and saying, "Hey, let me explain what this public health thing is," because like many of us who are listening to this, who are in public health, had no idea that public health was a thing, that you can do this type of work. So it truly is so important for people to sit down with us and share that information and say that, you know, you can approach health in this way and there's so much that you can gain. and affect the community. And I appreciate you also sharing the story of you wanting to become a doctor, like just being inspired from seeing measles in your community and then seeing that the response from the government wasn't reaching the people that it needed to reach the most, and just that burning passion to like, okay, so what can we do to like help people here? And that led you into wanting to do like these health related careers and leading you into public health, which is awesome. So and I also want to hear about the research that was published, but I'll ask you about a question about that a little bit later.
Okay.
So you are a public health trainee at the Ministry of Public Health in Doha, Qatar. How does that come up? Is that like you're Googling internships? Is it that the university has connections to Qatar? How did that come up?
Okay, for people studying public health, trying to get a placement, you have to explore so many options. I explored a whole lot of options. I even explored an option of becoming a environmental health and safety officer in a construction company. Can you imagine that? In fact, I already started. I already started because this is where my husband works. So I was actually searching for a place to do my industrial training, my placement. So I had to come back to Qatar. So I applied in different places. So I actually walked into the ministry and everything worked. I applied for it and I was accepted. A card was made for me. Everything was moving so fast. Okay. And so when I started, they were really supportive. If you are a student, you need not just everywhere should accept you. As a student, you have an option, because if you go into an institution that does not support you, the staff are not supporting, even the management is not supporting you, you are not going to gain anything. You will leave the same way you came. So when I went into the Ministry of Public Health, Qatar, all the staff were supportive. I was with the Communicable Health Protection and Communicable Disease Department. They showed me everything I needed to know. They took me into field inspection in the hospitals and the canteens. I saw everything. This is not what I read. They showed me everything. They were plain, and they allowed me also to practice. So I did hands-on activities a lot. So we had to do immunization programs. We had to do disease surveillance, and they had to take me to food safety, where I had to do food safety inspections with a template already designed checklist, where we monitor the school canteens, the restaurants, and I was also opportuned to go to the Central Food Laboratory. I'm privileged to be there because never before did I realize that all food that comes into the country we are tested. So every food was tested for chemicals, for toxins, for oxidants, for a whole lot of things. So it was a stepping stone for me. Sorry. It was actually a stepping stone. I couldn't believe myself, because when I came in here, everyone was telling me, the people I know, they were telling me, I'm not sure you can get. I had a lot of people discourage me. It was so hard that I started losing hope. Will I ever get to have a placement in a place like this? That was why I even went straight to construction, just do occupational health. After all, they are all part of public health. Mm-hmm. But I kept on pushing. That zeal, that passion in me, I was pressing forward. I convinced myself the only thing they can say is no. They are not going to kill me. They are not going to beat me. The only response will be no, and then you move to the next level. And as God may have it, I got a placement there. So they totally showed me everything that they do, which was in the field of public health. And I will tell you that even starting from the director to the manager to the technical coordinator to the specialist to the head of department, everyone was very, very supportive. And this gave me a first-hand knowledge about how the healthcare system in Qatar works, about how public health itself works. And I am really, really privileged to be a volunteer or an internship candidate in MPH Qatar. So I really want to use this opportunity to say a very big thank you to the management of Ministry of Public Health Qatar. They've been very supportive to students, not just me. They are very supportive in the educational system. When we talk about education, they are willing to give you, not just in the Ministry of Public Health Qatar, in other parastatals, other sectors in Qatar. They are really, really supportive. They are education minded. So I want to give them an accolade for that. So this is what I did. Thank
Yeah,
you.
yeah, yeah. Yeah, thank you. Thank you for sharing that. And
Mhm.
that's awesome for you to come into this organization and just get support and let people be there showing you like different ways that they are doing their work here. And what like coming from Nigeria, were there any things that were like really shocking to you in like the public health work, or was it did it all make sense?
Oh, when you travel in different places, you can experience culture shocks,
Right.
which we might have to talk about separately on the next podcast.
Understandable.
Okay, so
Understandable. And I was talking
okay.
with Faith before because I've actually been to Qatar before. I had family that lived there, so I can definitely understand and relate to the culture as well as many of you who listen to this podcast know. I also lived in the Middle East in the Sultanate of Oman for a couple of years, but this is not about me. Okay, I want you to share more about the project that you worked on and the paper that you worked on that was published. And I think you said in the Asian Journal of Public Health or Asian Journal of Medicine.
Asian Journal of Medicine. Asian Journal of Medicine. Yeah. Okay, so
Okay. Yeah, that's
I did a research in prevalence of fall and risk associated among construction workers. Why I chose this, it's because first of all, I thought I was going to go into occupational health. Okay, just to have a diversification of, since I've gotten an experience in communicable disease control back home, back then in primary healthcare center Abakaliki. So I thought I could have a diversion into occupational health to understand how it works. So I had to do a prevalence of fall. When I talk about fall, dropping from high, normal fall when we fall. So I wanted to see the demographic factors, if it has any association with the risk of fall. So we measured their age, we measured their educational qualifications, we measured their ethnicity, we measured their religion. We also had to measure their adherence to putting on of PPE, like the arrest belts when climbing up. So we had to measure a whole lot of things, and then defended the project, my thesis, and then it was submitted with the Asian Journal of Medicine. This was in 2019. So generally speaking, the prevalence of fall among these construction workers, it's aimed at stopping the occurrence of falls, because we have a whole lot of people injured, bedridden. For a fact, I have an uncle that fell from a palm tree. I don't know if you're watching me on
what?
YouTube or LinkedIn or anyway. I don't know if most of you know about palm tree, how tall that is, because
Very tall.
there was no very tall, because there was no safety harness included. Like there was no PPEs one when he went there, so there was a free fall. He just felt like a stone, and he was bedridden for years and for years. May God rest his soul. He passed. I'm not trying to tell you a sad story on this podcast, but I'm trying to tell you why it is very necessary to see the reason behind the prevalence of falls among people who are construction workers or people who are working in any company at all. Because these people go to work, they have a family to feed. So these are all the things I thought about to see if changes can be made. They have mouths to feed, they left their loved ones. So if anything happens to them, they become morbid or they die. We are going to have a whole lot of less privileged people on the streets. And when you have less privileged people on the streets, you have a community problem. You agree with me? When you have a whole lot of people on the streets who have nothing to do or who have nothing, no one to support them, there can be a community problem, or let me not say hazard, but there could be a community problem associated with that. So this was why I went into the prevalence of fall. And this study was published, and I presented this at one of the public health conference in Port Harcourt, and I'm happy they use it for their weekly reports, for their weekly surveillance reports. And I believe something was done about it, and we keep pushing so that our voice can be heard. We keep pushing because the people in the developed world have a whole lot of system put in place to monitor all this. So, but for people who are upcoming, we keep investigating, we keep talking to ensure that all these things are put in place to help the people who cannot help themselves. So This is all about my research. So you can actually go to Google and just type prevalence of fall. You're going to see my name, Faith Amarchi. I published that. Very soon I'm going to publish another one. I have like 2 research ongoing that I want to publish. So
Awesome. And yeah, I'll be sure to link that in the show notes so people can check that out. And as well as definitely connect with Faith on LinkedIn so that you can stay up to date when she does publish those new papers. And I'm glad that you highlight the importance of like using this research and this paper to kind of advocate for change, or like just advocate for to take care of this population, because as you shared with the story of your uncle, the devastating impact that can have on a family, on a community. So really like just being the voice for those people who mightn't have the power to tell their boss, hey, I don't feel safe here, but you coming in with the data and showing like,
right.
This is why we need them to be safe.
Yeah.
Yeah. And then you became a public health trainee for the COVID-19 response as a volunteer at a primary health organization. So do you want to talk a little bit about that experience?
Okay, yeah, you need to talk about that. Okay, when I came back to first, I'm going to rewind back from my internship. Okay, after my internship in the Ministry of Health, I had to go back to Nigeria to finish my exams for my master's degree, because if you remember, this is an internship, so it should be done while I was studying. So there was 3-month gap for that. So after that, I returned back home. So after my thesis, I published my thesis in 2019. So I had to come back to Qatar because my husband lives here. So this is why I know everyone will be thinking about why Qatar. My husband lives here and I love it here. Okay, so I had to come back. So I started applying in different places. I started volunteering for different organizations. I had to volunteer for Evolve Fitness. I have to volunteer for Qatar Diabetes Association. I had to volunteer for Supreme Committee for Delivery and Legacy. I have to volunteer for Al Shakab groups. So the Supreme Committee for Delivery and Legacy, they are the ones that took charge of the FIFA World Cup in Qatar last year, 2022. So they have a whole lot of volunteering experience and position for people. So I went back to primary health care, okay, here in Qatar, to apply for a volunteering opportunity. So that was around 2019. So when I was during 2020, we had this outbreak of COVID-19. If you remember, it started surging in 2020. So I continued to volunteer to support the team that we are doing what we are doing, did contact tracing for the healthcare workers. What I mean by contact tracing for the healthcare workers, if we have like 10 cases of staff COVID-19 cases, these 10 cases, we'll have to give a call across to them. We'll have our written down checklist to see who they've been in close contact with, to see the duration of time they were in close contact with these individuals, and to also see if they were exposed to these individuals or they were sitting close without their mask, without a proper precautions. Okay, so when we have this list of people, we'll add them to the list of people who are at high risk of getting COVID-19, and so it goes on and on. This is a very big work. It is sometimes we'll have a whole lot of numbers to call. Okay, so this is part of what I did with them. So also with the Infection Prevention and Control Department, we often do a health center supervision in order to monitor the adherence of the nurses, of the physicians, of the housekeeping, to ensure that things are being run well. And we also had the opportunity to check with the sterilizing department to see the type of sterilization they are doing, to check for engineering structures, if there's deformities, anything that needs to be replaced. We also have to check for the linen management. We have to check if the stores are being organized according to the policy, according to the guidelines stated for the health system and the management of linen. We have also to see the nurses about injection, needle stick injury. Okay, this is often because during then we had a big a mass vaccination. It was called a very big mass COVID-19 vaccination, where we hired a whole lot of nurses. And most of them, you agree with me, we are not properly trained because it was an outbreak. It was a pandemic. Actually, this has gone beyond an outbreak. So it was a pandemic and we needed a whole lot of help. Okay. So we ensured that these nurses are being up to date, regular and routine monitoring of these nurses during administration of vaccines, to check if they are practicing good hand hygiene. All the time we mention good hand hygiene because from our hands, this is the fastest route of transmission. This is a route of transmission that can kill a patient, kill a staff, even kill the leadership and management. So we'll try to ensure that everything is in place. And also we conducted the investigations about cases, how the cases are rising, and we are actually taking charge of the weekly surveillance report for the number of COVID-19 cases, where I was actually analyzing and making a data visualization according to the age. Is it affecting the infants, the children, the pediatric, or the adults, or the young adults, or the elderly? We're also looking at people with comorbidities to see people who are having this COVID-19, if they have other illness associated with them. And so we checked. I was really opportune to be working during that time because it really gave me I was so happy to be working when there was a pandemic. You know, sometimes we work from like 6 a.m. to like, I don't want to mention, but it was actually a rigorous exercise, and it was time consuming, it was energy consuming, but I kept telling myself, this is public health. You always wanted to be in public health. This is the right time for you to be in public health because everything was fast paced because,
Right.
you know, all over the world, we have high rates of hospitalization. Everyone was up and doing. There were a lot of training going around. I was included in the training. There were a lot of research going around, a lot of investigation going around, like the contact tracing I talked about, a lot of immunization awareness campaign going around. So I was included in all of that. So basically, this is the opportunity I gained. This is the lessons I actually got from volunteering during the COVID-19 and primary health center here in Qatar.
Yeah, that is very informative, and thank you for that work. Definitely is needed. I feel like we don't think about it a lot now, but like this was something that's happening all over the world, and you as a volunteer was very much needed in this space. And I also want to highlight that all the other roles that you mentioned that you were volunteering at, like the Diabetes Association of Qatar and those other organizations, because I think that's cool in itself, because it's like you're saying, okay, I'm in this new place. I might be able to get a job at this point in time, but what can I do to use these skills that I have to actively engage with the community and use my skill sets to support health and help people. So that's awesome. And I think like people should also think about, like, even if they are going into spaces where they're not initially going to get a job, are there ways for me to continue to build my skill sets and work in public health so that when I do get into that role, I'm able to like just transition more seamlessly.
Exactly.
And to that point, you became an infection prevention and control coordinator at the same organization. And as well as, I think you also worked as an I know that you worked as an infection control reviewer at another medical organization. So do you know, talk a little bit about those roles? And I know you wanted to talk about them together since they were very similar.
Yes, I talked about them because they're similar, because this is a rotational issue. This is like an operation program. The primary healthcare and the Hamad Medical, they are in the same corporation. So what changed was the title.
Right. Okay.
But I was in the same organization doing the same thing that I was doing before. So this is why I wanted to talk about both of them together, because of our time. I might be beating around the bush, the same scenario, the same thing. So
Right. So what did you do in that new role as an infection prevention and control coordinator or an infection control reviewer, which is the same, just different organizations, which is also, I think that's also something that people should like know, is like the same role might have different names at different organizations, which is important to understand as well.
Okay, it's different organizations have different grade. You know what is grade? Like different grade classification for different jobs. So another organization might decide to give grade 30 for infection control coordinator, and then another organization might decide to give the same position and put reviewer and give it to grade 31 or grade 29 or grade 28 or above. So this is just the name. You can be an infection control reviewer, you can be an infection control practitioner, you can be an infection control coordinator. It depends on the organizational policy. Like I said, this is an operational thing. This is an operational rules of how things went. But I was in the same organization. I was not moved. The name of my organization changed. The title changed, but it was still the same because they are under the same corporation. Okay, so we'll talk about Primary Healthcare Corporation and Hamad Healthcare Corporation. These two are together. So I basically did the same the same job all over and all over again. So it was just a rotational basis, but it was actually the same thing. So don't let the name confuse you as long as you're in infection control, except when they make you infection control manager. This is when you know you have a whole lot of, you have a whole lot of things on your hands to do. Okay.
Right. That makes sense. And what kind of work did you do in infection control?
Oh, infection control, like I said earlier, we made public health, make infection control interventions. We send them to the health centers, or have a whole lot of health centers which we supervise and coordinate. So it is our duty to ensure that the staff are adhering. How? Through supervision, auditing, risk assessment, and surveillance. I was also in charge of the weekly surveillance where I get the daily data, analyze this data, clean this data, analyze them and interpret them. What am I looking for? I'm looking for a possibility of an outbreak in the health center. Okay, I'm looking for something that is unusual. When we talk about an outbreak, we are talking about something occurring more than it's usually places. Like if you have 10 cases of measles, and then all of a sudden we start having like 20, 30 on weekly basis. So there's an outbreak. So something is occurring out of the usual. So my main focus was on surveillance. So my main focus was collecting data, all data, checking for needle-stick injury, checking for complaint. Also, we have to check for adverse events following immunization, because during the mass immunization, we are, as infection control department, we are also getting feedback from the nurses, from their patients who are having anaphylaxis, adverse events, or side effects. Okay, so we are analyzing this data and we are sending it to the Ministry of Public Health. So this was basically what I did. Because I was a volunteer, so many things are out of my jurisdiction. So I had a limit. So this is another thing you should understand as a volunteer, what I'm trying to say. I don't know how it works elsewhere, but in Nigeria and in some places and over here, as a volunteer, you are not like a full staff. Okay, so some certain things would not be shown to you, or you will not be allowed to speak for the company or for the organization, and you will not be allowed to comment or work on certain things, because this is where your level is. You are a volunteer, so you should focus on what you've been assigned to do. If you ask to do more and they give it to you, fine and good. But when you ask to do more and they try to tell you this is out of what you should do, just please focus on whatever you're doing and do it perfectly. Let it be fantastic. Do it very well. So majority of my job was in surveillance, actually, and health center supervision and making reports. So this is what I did as an infection control. So for other senior teams, senior staff members, so they needed stronger hands. Then they needed hands, people that were stronger, people that have been in the system for a very long time, people that have seen mistakes and corrected it, people that have been into a monitoring and evaluation of cases. You know, when you are in a system, when you have been dipped in a system for a very long time, it will be easy for you to grasp anything during a pandemic or during an outbreak. So during that time, there was no room for mistakes. And I understand perfectly well. So that was why most of my job was surveillance reporting. Good surveillance and reporting. My eyes were on deck, and then health center supervision. So it was really fun. So this is most of the thing I actually did during my post day. It was limited, actually. Yeah, it was limited, and I'm still happy. I'm still grateful about that.
Yeah, I'm glad that you said it was fun. I know, I know not everyone would think that way, but hey, it's always good when we fall into a role and like we enjoy the work that we're doing, as well as we know it's important work that's helpful to the community at large. So, yeah, that's awesome. And then in your current role, you're a health protection coordinator at primary healthcare. Do you want to talk about how do you come across this role, and then what do you do? And I believe you had some slides that you wanted to share for anyone that's listening. Definitely go over to YouTube so you can look at the slides.
We've been doing a whole lot of talking. I and Omari, this and that. So currently, I'm a health protection coordinator working in the same place where I volunteered. So while I was still volunteering, I had to be hired as a contract staff. So when I was hired as a contract staff, it was on 3-month basis with probability of extension. So I received several extension periods, and I was still doing my best. And I believe I was really giving my best, and my best was actually close to enough for the department and for the managers. So when the role of health protection coordinator presented itself, I had to take it. So I had to submit a fresh application. I was invited for the interview. The interview was rigorous. Okay. But because I was already in the system, I already understood what is happening. I already understand how the healthcare system works, because you cannot just go to a place and then apply for a job, especially if you've not have ample experience about how this system works. What they have in America is different. I believe that America have a different national immunization schedule than Qatar, and in the UK they have a very different national immunization schedule like in Nigeria. So you have to start learning all over again. So I saw that volunteering experience as a stepping stone, as an avenue to learn, to understand how things are working over here. So I will not be caught unaware. So when the position presented itself, I was very happy. So I applied alongside with other candidates. I have had a lot of candidates applying for the same position, and I had to study hard. I had to ask questions from my colleagues. I had to listen to them talk. I had to do a lot of reading also, because if you're not careful, if you think you've known all, you might be caught unawares, and they will throw a certain question to you, and all of a sudden you're lost. So fast forward to the end of the interview, I received a call. You've been successful about the interview, and I was very excited. Finally, my career is starting all over again. You can't imagine the whole happiness is just coming back to me one more time. I called my husband. He was the very first person I called. I said, "Hey, hello, honey." Sorry, I'm using this honey on this podcast.
That's fine. That's absolutely fine.
But really, he was the very first person I called, because he's been there all through. He's been very supportive, because I can remember when I came over to this country, I spent months, up to 8-9 months, without doing anything. At some point, I started going for teaching jobs. I started studying. I had a diploma in pre and primary education. I got a diploma in early years childhood education, because I wanted to do something. I wanted to do something to impact a large number of people. So that was why I went into education. But for him, he said, this doesn't suit you, because this is not what you have passion for. This is his statement. He said, I know you. This is not what. So another thing is to get someone who is a sucker, someone who pushes you even when you're trying to derail. So he was there. He said, I can never accept you do this. This is what you always wanted, because he knows me so well. Even when I got some teaching jobs, he will refuse to sign for me. You know how it was in Qatar. He needs to give me something to work, and he refuses to do that. For me, then, I wanted to make money. We all want to make money, right? So I would see my friends, they would go to work and all that. And then I wanted to do something. Okay. But at the end of the day, his help, his assistance from my master's education down to my volunteering experiences. So he was the first person I called. I said, I have scaled to the interview. We've done this, we did this, and this is how I got myself into this position. And I've been improving. I have a very great manager. He was very well knowledgeable, who understands that you're a beginner, who teaches you what you need to know, who gives instances, who gives you big projects he knows you cannot handle. I will never say no. I said I will try my best. He gives me things that he knows that is bigger than me, but I'll try to do it. I'll surf the internet. I'll speak with my colleagues. I'll speak with even people from the Ministry of Public Health. How can I do this? I'll even speak with someone from the Ministry of Public Health in Nigeria. I speak with a whole lot of people. I try to network with a whole lot of people. So I take those opportunities. At least I have to present something. Let it not be enough. Like present something, and then he will say, okay, you have to do it this way. You have to do it that way. So this has been my life journey towards my public health career. So I really worked for that because I have passion for it. So this is why I said everyone should go for what they have passion for, not because of this is raining, this is what is available, this is what is available, and this is what is raining everywhere, this is what is prevalent. So therefore I need to go dive into that career field. So this is how I got in as a health protection coordinator, currently and improving. I'm still a work in progress. We'll get there.
Yeah. We are all works in progress, so don't even stress about that. But I like the points that you say, and like even coming to this new country, just understanding that there are so many nuances and so many differences. I think you mentioned the example of the national immunization schedule and the differences between the USA versus the UK versus Nigeria versus Qatar, and just how that looks different. And like as much as you think you know, there's just so much more that you don't know.
Yes,
And you're putting yourself in positions to just be in that space to kind of get that information. And also shout out to your husband, because I know many times we put ourselves in positions or like try to do things that, as you're saying, it's not like fully aligned with what you
yeah,
ideally want to do with your life. And many times we don't have people who say like, no, that's not really what you want to do. I know that you can find what you want to do. And in that, like being able to get this job and to be in that role. And then as well, like shout out to your manager, giving you the opportunity to say, hey, take this big project here and let me see what you can do. And from that, you're going to get that growth and that better understanding, so that you, every time you get like bigger projects or the same size project, you're able to do more of it and just be more capable as a professional in public health. So that is awesome. So what are some of
and
like the main roles?
okay, the main roles. This is what I wanted to talk about. I thought I forgot about it because I was trying to catch up with all the questions. Okay, so now it's totally different because now you've been given access to everything. So you can fly above the sky right now because now you're in the system. You've signed an agreement with them, so now you have access to everything. So now list the list of things we do, and then I'll have tried to explain one of it. Okay, we are into Communicable Disease Control. Actually, my department is the Communicable Disease Control section, CDC. And then we are into disease surveillance, outbreak investigation. We are into immunization programs. We are into training. We are into research also. So we are into infection control also, because my department is health protection, but in my department we have two sections. One is infection control and the other one is communicable disease control. That is IPAC and CDC. So I worked with IPAC previously and now I'm with CDC. So our works are intertwined. So we basically enter into their roles and they can enter into our roles because we have the same, according to the structure, we have the same manager, we have the same role to play. So we've been talking about surveillance. I would like to just share just a brief slide to show you a brief about things about surveillance and why it is important in the field of public health, because you cannot have public health without surveillance. I don't know if you can see the slide, Amari.
Yes, we can see.
Okay, so this is just a brief. My name is already there, public health professional, MSc Public Health. Okay, and so first of all, try to call attention of people to communicable diseases. We have the herpes zoster. It mostly affects the elderly because of varicella breakthrough. We have the poliomyelitis. I believe polio should be on its way to eradication, but for now, polio is in elimination stage because we still have some in Afghanistan and Pakistan. And then we have the tetanus. You can see the seizures associated with tetanus. We can see hepatitis B affecting the liver. We can see the measles. We can see pertussis and whooping cough. We have a lot of lists, going lists of communicable diseases. So this is why it is important to keep an eye on these diseases, because we don't want a comeback. I believe that parents of these days, because of intervention of vaccinations, they cannot be able to remember anymore, or they have not witnessed the bad effects of poliomyelitis, the paralysis that comes with it, and also for tetanus. I don't think parents of this generation have seen the lockjaw seizures that come with it. I doubt if they've seen it, and even the measles, the discomfort, the irritation, and the death. The number of child mortality that comes with it. So we talk about disease surveillance. It's just an ongoing collection of data. We collect the data, we analyze the data, we interpret this data. I want to remind that every country have their own surveillance system. They have their own way of collecting disease surveillance data. So in the country I am, we have a system. We collect from the health center, from the primary health center, to us. We verify this data, we analyze this data, and we send out the report. Surveillance just have to do with getting information, first-hand information before anything goes wrong. It's just like putting a CCTV camera on in the school, or putting it in the house, or putting the speed cameras, the speed radars, the speed radars on the road to capture overspeeding. So we have types of disease surveillance. We have the passive surveillance. active surveillance, sentinel surveillance, but because of our time, I'm going to talk about only the three of them. The passive surveillance has to do with the physicians reporting a suspected case of communicable disease. For example, a patient comes with herpes zoster, and this is a 65 years old patient. So according to the physician's diagnosis and his skills and experience as medical graduate, he analyzes this disease after taking history as herpes zoster. This is a mandatory requirement that this physician needs to report this disease on the system. And then we receive this notification as the CDC team, as health protection coordinators. We receive the notification from the disease. And then what is active surveillance? When we receive this information, if there is something not working out together, for example, if we have a lot of cases of food poisoning, but the epidemiological links we are not written, where was the patient last meal, who did the patient eat with? If those kind of informations are not there, in active surveillance, we need to call the doctor, the physician from the system. We pick out their line numbers. We have to call to make an investigation. How is this patient presenting? Is this patient coming with their family? Are the other members of the family having it? Or is this patient eating out with his friend? Which restaurant did this patient eat in? So this is a kind of active surveillance. In active surveillance, you're making use of the information you got from the reporting, which is the passive surveillance. I don't know if, I believe I'm trying my possible best to explain it and make it as simple as can be. Then we have the sentinel surveillance. In sentinel surveillance, this is a designated specialized healthcare facilities that have been designated to collect samples of certain diseases. Like, for example, we have let's say influenza-like illness sentinel surveillance. Here, maybe like 5 health centers or 5 hospitals in the US will be assigned because of their geographical areas in order to accommodate and make it accessible for people in different parts of the country to come to. So they are in sentinel side, these 5 health centers are given the authority, the obligation to collect and swab all the cases of influenza-like illnesses and report them. So this is the difference between the passive, the active, and the sentinel surveillance. And then how do we get our data from the notifiable diseases we get from the physician, from the lab specimen, vital record, even surveys and registries, and sentinel surveillance like of the ILI that I talked about. So what do we do with disease surveillance? How do we do it? It's very simple. From the data collection, you analyze the data to interpretation of the data, which can be presented in form of a bar chart, line chart, in tables, in maps, especially if you want to show the geographical prevalence of diseases. For example, if we have high cases of COVID-19 in Florida, and we have highest cases in, let's say we have 80% of the cases of COVID-19 in Florida, and in North Carolina we have like 10%. So we can actually use the mapping to distribute, to present our data to show the high cluster of cases in Florida more than in North Carolina. You can also use the pie charts to see the proportion, the percentage increase or the percentage incidence of certain diseases. Then also, when we get this information analyzed and put into data, you interpret this data, because not everyone can read the graphs. Not everyone can interpret the maps or the line chart. Then you put interpretation. It can be in any format you want, in a PowerPoint, in MS Word, in anyhow you want to put it. And then what do we do with this data? We disseminate this data. We'll send it out to the physicians, to the nurses, the Ministry of Health, then to WHO, and then to the public. Because remember, in public health, you have to make the public aware of it. If there's an outbreak of COVID-19 and you hide it, it will spread like wildfire, but you need to involve the public. So what we get from the surveillance, we distribute to the public, what we call the health education and health promotion. And then there is need for action, and action include investigation, controlling of this disease, and then prevention. Prevention can be by precautions, standard precautions, contact droplets precautions, vaccination, training, even improving of lifestyle, environmental hygiene, good personal hygiene, appropriate cooking, thorough cooking of food, and all that. So the importance of this disease surveillance, actually, it is to detect outbreaks quickly before they even spread and cost lives and become very difficult to control. During COVID-19, there is a lot of hospitalization, and there was a high burden, I can believe, nationwide among healthcare staff. So outbreak investigation or surveillance is really necessary to avoid all this hospitalization. If you can see, the healthcare workers are falling sick, going home for isolation. Imagine you have around 20 healthcare workers sick today from COVID-19. Of course, they will not be at work. You have reduced number of people to attend to high number of COVID patients. You can understand the high burden of these diseases on the healthcare system. So this is the importance of surveillance. It can act as an early warning sign that there could be a potential outbreak of disease. So the last question, who can be a public health a surveillance expert? Anyone can actually be a public health expert if you work towards it, if you have the passion, if you have the support you need. Even if you do not have the support, you can actually support yourself. I know a lot of people who have supported themselves financially, determination, dedication. That covers everything about public. So this is a brief thing we do about surveillance. I do not want to go into immunization, training, research, awareness, and campaigns. These are all stories, different stories on its own. So this is basically what health protection is all about. In health protection, we are preserving the health by working to prevent. We prevent. While in health promotion, they disseminate the information gotten from us. They try to convince you to create awareness. This is health education and promotion. They work hand in hand. While health protection, we are on the background doing things to prevent diseases from happening. So this is the difference between, because most time people will say, what is different between health protection and health promotion? Health protection is at the background, surveillance, trying to prevent diseases from happening. And even when it happens, they try to put a barrier before it happens. And then for health promotion, when they come about this information, what are they going to do? Health education, awareness, campaigns, messages, social media. So this is basically all about the health protection job positions in the primary health center.
Yeah, that was very, very informative and very helpful. And I like how you tied it back into like having to give this information to the community, as well as how it interrelates to the health protection aspect and factors that public health does, and like how you are being like the person that's collecting the information, sharing the information, and then how that relates to them being able to get educational information out to the community to like really focus on that prevention side. And you dove deep into a lot of different types of surveillance. So really, greatly appreciate that as well.
Thank you.
And I guess like, and I look forward to following along to see like what your career progression looks like, what type of work you continue to do in this role and in other roles that you potentially have, as well as to see the papers that you're going to be publishing in the near future as well.
Hopefully, yeah, moving towards it.
Always hope.
Hopefully.
Hey, you just gotta take a step a day, and you'll get there. And I look forward to it. Yes, okay. Yes. Yeah. So before I move on to the Furious Five, I'd like to ask, where would you like to see yourself in the future?
A very big question, but actually I have a very simple. I really have a very simple answer. I want to help people. A whole lot of people have their voice suppressed. They want to speak out. They are speaking out, but nobody can hear. Nobody is hearing, because globally in the world we have different classes of people. We have the people who matters. We have the people who matter a bit, and we have those people who doesn't matter at all, but they are speaking. So in the next 5 years, when you talk about 5 global Black women in public health, I want you to hear about Faith Amarchi. This is what I need, because I need to use this platform to bridge that gap between the haves and the haves not. Okay, I need to use, because when I speak for them, I can be able to influence policies. I can be able to influence decision makers, okay, to actually tackle the problem and attend to the problem of those people. So I would like to see myself in a position where I'll be among the top 5 global public health women in public health, in order to use my platform to help people, the pregnant women, also the women who does not have sufficient education to speak for themselves, or who do not have sufficient power, even education to understand that this sign, this symptom needs hospital attention, or need to seek for medical health behavior. Okay, so I want to use this opportunity to this platform to influence, to go down to the deep roots, as in, like, I don't know how to explain it, but I want to be heard. I want to be like an influencer. For example, if I have like 100 million followers, everybody will listen to me, because once I drop a dot, even if I drop a dot, everybody will start writing. Do you know that Faith Amarchi, public health specialist expert, blah, 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 has dropped a dot? But if someone with like maybe 1,000 followers drop even a full note, nobody will understand. Nobody will talk about it. So I want to be in that position where I can use my platform to influence greatly on the less privileged, the pregnant women, the uneducated women that need help, even for children, because maternal death is real. Even if it is underreported, maternal death and child mortality, it is very high. I do not want to mention countries and all that, but even in the developed world, it is still occurring. It is very, very high. Even for family planning, a whole lot of women do not know what is family planning and how to go about that. So I have a whole lot of things I will want to do, but I do not have a bigger platform yet to do this. And I believe even with the podcast you're doing, someone can speak about this, and who knows how it's going to get down and influence the policy makers, the decision makers, the bureaucrats to change and channel their resources to these people who are far reached. So this is basically as simple as that. They want to be in the same 5 years.
Simple and lovely. Love it, love it. And I think that that's so important to use our positions, our privilege, our space and platform to give voice to those people that are voiceless, as you're saying, because without us, they are just going to be in the same situations and maybe even more so oppressed. So it is really up to people like ourselves to take it on us to use what we have to inform and try to advocate for them so that we get systems that are more just and are able to help those people that need it the most. So I look forward to seeing that, and everyone be sure to connect with Faith on LinkedIn so that you can follow along.
Okay.
And then moving on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Okay. I will give an advice from my experience and from what I've seen. So if you're a student seeking to venture into public health, I will tell you this is a very interesting field. I must tell you, it is fantastic. It is a field where you have to mingle and meet a whole lot of people, understand different scenarios, different characteristics, different behaviors. It is a course where you feel you're doing something to help in your own little way. So first of all, you have to have passion for it. You don't need to go into it because of the job or because people are going in for it. You have to make sure, because you might finish this course and then you run away from it and go into environmental health or go into tech. So you have to do something you have passion for. You have to have a reason for doing something. For me, I had passion for that. I had passion to work with the public, to make changes, to save lives. Okay, so that is number 1. You have to have passion for it. 2, public health is a very wide field. It's very wide. So you have to have a focus before going into that. For example, if you're very good at writing, making inquiries, asking a lot of questions, you want to understand what is happening in each and everybody's life, you have to go into research. It is very vital for you to go into research because you want to know more, and research is wanting to know more. So in public health, there is room for research. If you're someone who steps into an environment and everyone is smiling and everybody wants to listen to you, everybody's excited to see you, you're someone when you're talking and gisting with your friends, everyone's attention is on you, you can go into health promotion and health education. This is an advice I have to give to people. And if you're someone who wants to change lives, who's not afraid of diving into the deep of communicable disease, and because, for example, they call us highly infectious ladies in my department. This is whenever we go for training, they say we are presenting to you the highly infectious ladies. If you're not, so if you're not afraid, if you want to save lives, if you have something embedded in you that have been a disturbance to you, like to save people from dying from little diseases, you can go into communicable disease, epidemiology of diseases. So you can look into yourself in your mind. You know yourself better than anyone. So look at what you want to do. If you're into economy, if you love leadership so much, you can go into healthcare leadership and management. You can go into healthcare enhancement, improving of life. You can go into non-communicable disease. For example, if you have a colleague or a family that have died of cancer, diabetes, and you know all these things can be prevented, and you feel very bad about them, these are the things you can do in order to prevent this from happening to someone else. So I'll just basically advise you to have passion for it, know what you're going for, know the reason why you're going into this, and then study hard. make research, make inquiries. I bet you the sky can never even be your limit. You soar above the sky because this is what you have passion for, and this is what you know you can do. And nobody can beat you in that field. Even at the beginning, it's not going to be very easy because you have a whole lot of professionals who are ahead of you. They're going to choose certain terms and you will not understand them. But even keep on asking questions, researching and studying, and I believe everything will fall in place in time.
Love it, love
Okay.
it. You can go beyond the sky, as Faith says. So just believe in yourself. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Okay. Like I said earlier in this podcast, I had a passion, which I said earlier, volunteering. Volunteering will give you hands-on experience. It will give you will think you're not progressing, but you're actually progressing. They are sticking into your brain little by little. You are seeing. I believe that what I listen, I hear, I forget it. But what I do, I can hardly forget about it. I will remember it. So give yourself volunteering. Like the name sound, volunteering. Don't expect anything in return. Definitely. But if they give anything to you, take it in good faith. When I volunteered, I volunteered for about a year plus. I received not even one incentive, not even a tips, not even transportation allowance, not even nothing. I was renting a car. I was driving to work. I was going to work as early as I was working like other staff, and I was getting nothing in return because I wanted to grow my knowledge. Like I know even that if they don't hire me here, I have a potential of getting a better job elsewhere because I can be confident to say this is what I know how to do. I can practice it. I can do it. So have a passion, volunteer, then networking. You have to network. Jobs don't fall from heaven, from the sky. You have to network. You can network on LinkedIn. You can network on conferences, even virtual webinars. You can attend random public health webinars, conferences, and all that. You have to network. Add people who are in line with your career on LinkedIn, and not people who are like, for example, into engineering, into arts. They cannot offer anything, much things to you. But when you align yourself with people who are on the same trading on the same career path with you, you would definitely get information from them. Either job opportunities, fellowship opportunities, internship opportunities, even knowledge. You acquire a whole lot of knowledge from these people. So this is the advice I want to give to anyone trying to venture into this field. Have a passion for what you want to do. Be dedicated to your job. Keep pursuing it even when nothing is coming. Volunteer. You have to volunteer in different places to gain knowledge. The essence of volunteering is to get knowledge. We can read it, we can watch it on YouTube, but when you're asked to do it, you'll be confused. But when you listen to people, senior colleagues talk, you have to write it down. I will give you an example of what I did when I was volunteering. For every day, any task I did, I opened an Excel sheet. Day one, I put on the date I did this. Completion, maybe 70%, I'll put 70%, 100%, finished it. On day two, till after 1 year, you know what this will help with? It's when you want to arrange your CV will not look like copied from the internet. You will copy everything you did. Just imagine you have duties and responsibilities for like 2 months. Your CV is full. You're copying exactly what you did into your CV. You can defend them even closing your eyes. So this is how I did mine. So I have a full list of what I'm doing. Even right now that I'm working, for every day or for every week, if I have a newborn, I cannot have the whole time in the whole world like before to do them. I compile them weekly. I write them on the paper, like my small notes, and then compile them weekly and put in the system. This will help you to remember, one, what you did. So if you receive the same similar task, you have to go back and remember, oh, this is how I did it. This is who I contacted. This is what happened. And this was the result. So this is an advice I'm going to give. Passion, volunteering, networking, and then put on everything on the system so you will not forget what you did.
Great advice. So I appreciate you sharing that. And then number three, what's something you're working on improving in your life right now?
I'm actually working on my data analysis skills. Currently, I work with some analysis softwares, and you cannot work fully with public health if you don't have a good data analysis skill. You have to be good with data analysis. You have to know how to use certain softwares like the Starter, like the SPSS, like the Power BI, even the Excel. So currently right now, I'm trying to work and improve on my data analysis skill, my presentation skills also, my speaking skills. I've had the opportunity to be speaking, like recently last month, we held a 3-week training for the medical doctors, for the physicians about the importance of immunization. Okay. So I've been privileged. My manager gave me the privilege to speak to them. And I believe within this week, I have improved drastically with my communication skills, with my presentation skills. It's not just about speaking, it's about looking at the audience to get a feedback by nodding or to see if your audience are getting what you are saying. So right now I'm working on my analytical skills and I'm working on my creativity skills. I need to be creative. I need to develop projects, public health programs and projects. This is what I'm working on. I'm researching. I'm trying to understand what is happening in different parts of the world in the healthcare system in order to improve on myself. So, and my communication skill. So this is what I'm actually working on right now.
Love it, and love that you're actively working to improve on it. So number 4, professionally, do you recommend anything?
Professionally, I recommend being yourself. When I talk about being yourself, it means, for example, if you have a passion or you want to study engineering, and then you have a friend who studied IT, for example, computer, and then this friend gets a job immediately, and oh wow, what a wonderful package! And because of that, you've left your engineering course because you have passion for this, what you know how to do. Maybe, for instance, you know how to fix little bulbs, little things in the house, you know how to fix them, and you have this passion. I can do well in this, and then you get distracted by a peer. Your friend is getting a big job in computer. Instead of going for engineering, you rush to computer. You will lose it. You will miss it because this is not what you know how to do. So my advice professionally is be yourself. Be polite. Being polite takes you very far. Being polite to everyone, the elderly and the youngest one, it does not matter. But I believe it has taken me very far. Being polite, being humble, and then being yourself. Don't get any distraction at all. Don't be diverted for no matter reason or whatever. Just go for it, except in a case where the reasons are beyond you to handle. Okay, it's understandable. But apart from that, if there's no outlier, be yourself, be polite, be humble. This is what I have to offer anyone trying to
Great.
be in the public health field, because public health takes a lot of patience, a lot of tolerance, because you might make a public health law, you might make a public health intervention, and you put it out there, and someone will just looking at you, fling the paper, thinking it doesn't matter, because they need to get the job done. So you need to be relaxed. You need to keep your acts together. So you have to learn the skill of patience, humble, being polite, if you want to scale through in this professional line. Okay.
Great advice. And then last but not least, where can people connect with you, Faith?
People can connect with me on LinkedIn, Faith Amarchi Ngwu, or they can connect with me on my email, Faith, my name, then BLAZE @rocketmail.com. I believe these are the 2 places people can connect with me for now, especially my LinkedIn and my email. My email is always active. I can see anything that pops in, and then my LinkedIn, I'm very active on the LinkedIn. You can actually reach me there. So in the future, if I have any platform where people can easily reach me also and very accessible, I will not fail to upload it on my LinkedIn, to put it on my LinkedIn profile.
Awesome. I'll be sure to link that below so that people can connect with you. But thank you so much, Faith, for taking time to come on and chat with me today and share about your story and your insights. I think it was very valuable, and I enjoyed hearing more about it.
You're finished already? So it seems like we just started. Honestly, it seems like we just started, like we should keep going on and on and on. But I'm really happy to be here. You're doing a very great job. I had to go through your podcast interviews. They are quite great. They are really good. Keep up the good work. You've had a lot of podcasts, a lot of insights, a lot of presentations and lectures from different people. It's encouraging. I must tell you, you've encouraged me or inspired me in a way you will not understand, because it has always been my dream actually to work to actually reside in the US, especially in the Florida. I want to, but those are dreams and they're going to come to pass. And now I know how to go about what I'm planning to do. So a good job. Keep it up. I'm really happy to be on your podcast, and I'm always available anytime to speak on any topic. If you need me to be on your podcast, if you need me to invite my colleagues for you, I have a colleague. She's an immunization specialist. She's great. So these are all recommendations I can make for you to support your platform. Thank you so much, Amari, for this. I'm hoping to see your face in a few weeks' time.
Yeah, my pleasure. Thank you so much for those kind words, and I'm happy that I can share your story and other stories like it and be inspiring to other people, and look forward to connecting more with you and connecting deeper with you. So housekeeping items, everyone. Thank you so much for watching or listening to this. If you're not subscribers yet, be sure to subscribe. Leave a like if you're watching this on YouTube. Leave a 5-star review and share this with a friend. Those are the 2 ways to really get the show out to more people. And I greatly appreciate you all. Peace.
All right. Thank you.